Okay, the next chapter we're going to listen to is Miscellaneous Central Nervous System Medications, Chapter 14. Introduction. The neuromuscular blocking agents can be used for several things. Muscle relaxation, seizures, ECT, which is electroconvulsive therapy, suppressing the gag reflex during ET or endotracheal intubation. The drug that they typically use for that is succinylcholine, which also it's abbreviated. You'll hear people say sucks, and that's what they're talking about, succinylcholine. Muscular relaxants and antispasmodic agents. These are going to be used for muscle injury, cerebral palsy, spinal cord injuries, multiple sclerosis, spasticity, which spasticity is continuous contracted muscle. The medications that they'll use are diazepam, baclofen, and dantrolene, and we'll talk about dantrolene for another use as well. Muscarinic agonist, which remember this one mimics the action that is going on. So urinary retention, they use this medication for to treat. It's bethanical, and then there's muscarinic antagonist, which works against. It works for neurogenic bladder. The neurogenic bladder, that is a bladder dysfunction. It's flaccid or spastic. It's due to a cause of a neurological damage. So signs and symptoms that you're going to see of this is going to be overflow incontinence, frequency, urgency, retention, and urge incontinence. And they use oxybutene or Dipervan to help treat the neurogenic bladder. Okay, so the first one we're going to talk about is the neuromuscular blocking agents, which is your succinylcholine. This is going to mimic the acetylcholine by binding with the cholinergic receptors at the neuromuscular junction. It's depolarizing, resulting in muscle paralysis. So it's going to make that muscle not be able to move. It's going to keep it still and relaxed. Therapeutic uses are your neuromuscular blocking agent or are adjuncts to general anesthesia and promote muscle relaxation. So you want those muscles relaxed if in the neck. If we're going to put down a endotracheal tube, because obviously if those muscles are contracted, you're not going to be able to get that tube through and into the lungs through the trachea. And then neuromuscular blocking agents facilitate the endotracheal intubation and then endoscopy when they're putting the tube down to look down into the stomach. Succinylcholine, the complications can be prolonged sleep or prolonged apnea. So this is when they quit breathing. Malignant hypothermia, which is what we can use dantrolene for to help treat. Malignant hypothermia, this includes muscle rigidity with increased temperature as high as 109.4. IV dantrolene is going to help decrease that metabolic activity of the skeletal muscle. So you need to remember that it works on the skeletal muscles. We need to monitor the vital signs. We need to stop the succinylcholine and other anesthetics. You need to give 100% oxygen. You need to obviously initiate cooling measures. So think of how we're going to do that. We can do cold IV fluids, ice in the groins, a cooling blanket, putting ice underneath in the armpits. And then we always need resuscitation and intubation equipment at the bedside or on hand, just in case it leads to that. Okay, sorry, let's go back to prolonged apnea. They might want to do just a small blood test or administer a small dose for the client to see if it might have low levels of the pseudocholinesterase. That is what causes the prolonged apnea that's in the medication. Muscle pain. This is muscle pain in the upper body and back. It can develop anywhere from 12 to 24 hours post-operatively and last for days or hours or days. We need to inform the clients that this is not an unusual or eventful. It will subside, so not to get overly excited and think that something's completely wrong. And they just need to ask the provider to consider short-term use of a muscle relaxant to help with this, just to get over that period. Hyperkalemia, which is your high potassium. Once again, think about what's going on. If we have high hyperkalemia, that's high potassium. So what have we talked about in the past that potassium affects the heart? So we need to watch for dysrhythmias that can cause this, and we need to monitor, obviously, their potassium levels. And once again, remember, write down before I say it, what is the normal potassium? I'll give you a couple of seconds. 3.5 to 5 is normal potassium, so they need to make sure that they keep an eye on that and it's not above 5, because that's when you're going to run to possibly into problems. This can lead to cardiac arrest due to the dysrhythmias. So, okay, contraindications and precautions. Pregnancy risk category C. Anybody that has hyperkalemia or has had a major trauma, severe burns, any certain types of nerve impairment should not use succinylcholine. Clients that have myasthenia gravis, which is a muscle disease, deteriorating muscle, respiratory dysfunction, or fluid and electrolyte imbalances requires precaution when using these medications. Just side note, neuromuscular blockers medications are not anesthetics and therefore have no effect on the consciousness, hearing, thinking, or the ability to feel pain. This is more of a muscle relaxing agent of the skeletal muscle, especially in the neck. Interactions, general anesthesia, aminoglycosides, tetracycline, neostigmine, and other cholinesterase inhibitors. Nursing considerations, obviously cardiac and respiratory monitoring will need to be done closely. Okay, muscle relaxants and antispasmodics. This is Valium. Is going to be your centrally acting muscle relaxant. It acts on the central nervous system to enhance the GABA, produce sedative effects, and depress the spasticity of muscles. The uses can be muscle spasms, status epilepticus, alcohol withdrawal, and anesthesia induction. Complications, it can be physically dependent, so we need to watch for those signs: sleepiness, lightheadedness, fatigue. So just inform them, don't be doing any driving or operating machinery. They need to be prescribed at the lowest dose. Let's see. And this is going to be more with long-term chronic use that the physical dependency will occur. Contraindications and precautions. Baclofen is a pregnancy risk. Diazepam, sorry. Pregnancy risk category D. It is a controlled substance. It's a Scheduled 4, so it has to be prescribed in a written prescription from the physician. If anybody has liver or kidney dysfunctions. Interactions, obviously CNS depressants, because they're already being depressed. We don't want to add to that. Nursing considerations is do not stop taking this medication abruptly to avoid withdrawal symptoms. Avoid any CNS depressants, and then provide assistance with self-administration of medication and performance of your ADLs. Because if it's causing some sedation or some drowsiness, lightheadedness, then you may need help with those. Help your client with those ADLs. Baclofen, it acts on the central nervous system to enhance. It basically does kind of the same thing as the Valium does, the diazepam. It's just that there's no effect on the skeletal muscles with baclofen. It's the relief of spasticity due to cerebral palsy, spinal cord injuries, or multiple sclerosis. Sorry. Complications: nausea, constipation, urinary retention. Constipation, once again, exercise, high fiber diet, 2 to 3 liters of fluid a day. And urinary retention, have them keep an INO, make sure that what's going in is coming out. Seizures, monitor for seizure activity, and then just, report that if it occurs, report it to the provider. Contraindications and precautions, it is a category risk C, pregnancy risk C. Interactions, the CNS depressants as well, and the same nursing considerations as far as don't stop it abruptly, don't take any CNS depressants, and you may need help with the medication and ADLs. Okay, dantrolene. This is a peripherally acting muscle relaxant that acts on the spastic muscles and inhibits muscle contraction by preventing the release of calcium in the skeletal muscles, which, remember, we need that calcium in there for those muscles to contract. Therapeutic uses: relief of spasticity due to cerebral palsy, spinal cord injury, and multiple sclerosis, and then malignant hypothermia. Complications is hepatic toxicity, so we need to anorexia, nausea, vomiting, abdominal pain, jaundice. So have them look for signs of jaundice, which we see, remember, the yellowing in the eyes. Get baseline liver function tests, and then obviously we need to monitor that throughout therapy. And then prescribe the lowest dose. Muscle weakness, so we just need to monitor the effectiveness of that medication, that it's doing what it's supposed to be. It is a pregnancy risk category C. Interactions are going to be the same, your CNS depressants, and also the same nursing considerations of not stopping abruptly, and then CNS depressants avoid, and then your assist with ADLs and medication. Which dantrolene is given IV push, so they won't be on it as a pill at home or anything, so. Muscarinic agonist, remember, it mimics bethanical. It works by stimulating the muscarinic receptors of the GU tract, causing relaxation of the trigon and the sphincter muscles and contraction of the deterger muscle to increase the bladder pressure and the exertion of urine. It's used for non-obstructive urinary retention. Complications are the extreme muscarinic stimulation, which we had talked about this before, increases the gastric acid secretion, excessive salivation, and sweating, abdominal cramps, diarrhea, tearing, urinary urgency, bradycardia, hypotension, and bronchoconstriction. Administer this on an empty stomach to reduce the GI effects. Monitor for bradycardia and hypotension, and then just to report any of these adverse effects to their provider. Contraindications are urinary and GI obstruction, peptic ulcer disease, coronary insufficiency, asthma, and hyperthyroidism. Nursing considerations: administer PO 1 hour before or 2 hours after meals to minimize the nausea and vomiting, and then monitor the INOs closely. Muscarinic antagonist, which remember it works again, so oxybutyn, which is Diprivan. It inhibits the muscarinic receptors of the deterger muscle of the bladder, thus preventing the contractions of the bladder and the urge to void. Overactive bladder, so it kind of slows that bladder down, so we're not having to go all the time. Complications: anticholinergic effects like the dry mouth, constipation, blurry vision, photophobia, dry eyes, tachycardia. So we're going to increase the dietary fiber, exercise 2 to 3 liters a day of fluid from food and beverages. So just sip on fluids all day. Avoid driving or any other activities that require vision, just in case it is blurry or you have the dry eyes. We can do re-tearing, refresh drops, or like you can do for the eyes. CNS and cardiovascular effects: hallucinations, confusion, insomnia, nervousness is the CNS effects. The cardiac, it's going to affect the QT interval. It's going to prolong it. So we need baseline EKG. And then just have them report any of these manifestations to their provider. Contraindications are glaucoma, myasthenia gravis, paralytic ileus, GI and GU obstructions, and urinary retention. Precautions: children and older adults, just because of you can overdose them very quickly. GERD, heart failure, and kidney or liver impairment. Interactions are antihistamines, tricyclic antidepressants, or phenothiazines. And then nursing considerations: intestines will eliminate the shell of the extended release tablets. And then the transdermal patch twice a week on the hip, abdomen, or buttocks. And you want to make sure that the skin is dry and rotate those sites. So don't keep putting it in the same site